I am realizing that as I am talking more and more about lipedema and as awareness in general is increasing, which is amazing, more and more people are starting to recognize symptoms in themselves and people that they know. It is so important that as you are recognizing this and you might be thinking about seeking a diagnosis or having the lipedema reduction surgery. The surgery requires a niche skill set that not every board certified plastic, dermatologic, whatever the surgeon may be is going to have. I want people to be very careful when they're selecting their surgeon and really do their due diligence, really do their research into who this person is that they're entrusting their body to. Unfortunately, there isn't a certification for somebody to say, I am a lipedema specialist. And that's a little tricky because any surgeon can claim that they are a specialist. Hopefully that'll change. But for right now, when you are looking for a surgeon, you have to really be your best advocate. And I wanted to share with you the things that I did. It took me a good year. I talked to 4 different surgeons. Insurance coverage isn't great. It's gotten better. But there are surgeons that have a team dedicated to helping their patients get insurance coverage. I know that these procedures can be expensive and it's scary, but we are not shopping for a new pair of shoes here. The best deal is not always going to be maybe the best choice. You only have one body, and I just really want people to keep that in mind when they are thinking about moving forward with surgery. This is what I did as far as my due diligence, my research into choosing a surgeon. I looked at the pedigree of the surgeon. Where did the surgeon go to school? Where did they do their fellowship, get their training? What type of procedures does the surgeon do? And of those procedures, what is the percentage that they're doing lipedema surgery specifically? How long has the surgeon been practicing in general, but then how long has the surgeon been practicing lipedema reduction surgeries? If you are a later stage patient, does this physician perform procedures on patients that are further progressed? There are different techniques that surgeons prefer. I wanted to understand what those techniques were. For me, I have a history with DVTs, which I learned that people with lipedema, it can make you more susceptible to DVTs. So I did not want to go under general anesthesia because that can increase the risk of DVTs. I wanted to do twilight sedation. So that was something that I factored into my choice. That's the meat of that. But a step further is, what does this surgeon's practice offer beyond the procedure? Is there a surgical coordinator to help break down the steps of your treatment process? Is there a dedicated team to help with trying to get insurance coverage? Is there an MLD therapist in the office? If you have questions, can you get answers? The office was closed over the holidays after I did my first surgery. I could reach out to the nurse practitioner and email her, and she would get back to me within 24 hours, and it was usually like within hours. And finally, it is so important that you talk to patients, join support groups. If you go onto Facebook, there are so many lipedema support groups. Talk to patients that have been through the process, that are working with surgeons right now. Are they happy? What's their experience been like? You're watching my journey, and I'm so glad that I can share that with you guys. But every surgeon is going to have a different treatment plan for you because we are all different and every surgeon is different. Talking to their patients, that's how you're going to best understand it. For me, Dr. Amron was the surgeon that I clicked with, was the surgeon that I felt his technique and experience was what I was looking for. Does that mean I have to travel to California and I live in Florida? Yes, but I only have one body. So just take your time, be cautious of anyone trying to sell you something as you're going through this process of trying to choose a surgeon and figure out the insurance. Whether you go and see Dr. Amron or not, I do recommend, he has a book that he recently published about liposuction, lipedema, the difference between cosmetic liposuction and lipedema liposuction, the different techniques that different surgeons prefer. It's very informative. If there's anything that I didn't go over and any other questions that you have, please let me know. I'm happy to do another video like this.